Good morning, everyone. Thanks for joining us this morning for QI Power Hour. My name is Chelsea Schwartz with the Saskatchewan Health Quality Council. For those of you joining QI Power Hour for the first time, this is a free monthly webinar series hosted by the Saskatchewan Health Quality Council. We bring together improvers from a variety of sectors with an interest in improving healthcare to learn about quality improvement related topics. This morning, I'm joining you from our HQC office here in Saskatoon, located on Treaty 6 territory and homeland of the Métis. And just a heads up that our session today is being recorded. So if you have to hop off for any reason, just know that the session will be available as a recording following the event. I'll also invite you to check out some of our past sessions on the HQC website. I'll have my HQC colleagues drop the link in the chat of where you can find today's sessions and past sessions. And while you're on our website, we do invite you to sign up to our distribution list. This will make sure that you don't miss a future QI Power Hour and stay up to date with the sessions that we have on tap. And so I'm just delighted that over the past number of years, we've had such uptake and spread over of this offering throughout our home province of Saskatchewan, throughout our country of Canada, and in fact, across the world. So thank you so much for taking an hour of your day to learn about improvement and for your dedication to improvement of the sectors that you are working within. So today, you'll notice that as you joined, we are in the webinar platform. So this means that you're unable to unmute your line, though we definitely do want you to participate in today's session. We'll invite your questions, your comments, and your ideas through the chat. So you can find that chat button located on the bottom right-hand side of your screen. We'll just invite you to dedicate your message to everyone in the to field there so that we can all take part in the conversation. So just to give that a try and test it out, make sure you can find it. I invite you to pop in to the chat this morning, the organization that you're joining us from. Perfect, thank you. And so with that, I am delighted to introduce our speaker today. So we have Lindsay Beckler joining us. Lindsay is currently pursuing her PhD while serving as a research manager with the Saskatchewan Polytechnic Centre for Health Research, Innovation and Scholarship. Lindsay is a 2022 recipient of the prestigious Vanier Scholarship, and she was awarded the 2022 Paramedic Association of Canada Award of Excellence for Research and Innovation for her work in health research. Lindsay's research explores how virtual reality technology can be used to promote the mental health and well-being of Indigenous youth living in rural and remote communities. Virtual reality-based mental health supports offer an appealing, safe, non-judgmental, and innovative approach to accessing care and resources that may otherwise not be accessed by those in need. And so with that, I'm delighted to welcome Lindsay to our session today, and I'll pass things over to you, Lindsay.
Wonderful. Thanks so much, Chelsea. I appreciate it. And thank you everyone that is taking the time to join us today. I'm so excited to share a little bit more about the work that we've been doing with our community partners here. So as Chelsea mentioned, my name is Lindsay Beckler, and I am presenting to you today from Treaty 4, I'm on Treaty 4 territory. Sorry, I had in my notes Treaty 6, and I was like, last time I was presenting, I was on Treaty 6 territory. So I'm presenting to you from Treaty 4. Sask Polytech is on Treaty 4 and 6 territories, and these are the traditional lands of the Cree, Ojibwe, Saulteaux, Dakota, Nakota, Lakota, and homeland of the Métis Nation. So in acknowledgement of the harms and the mistakes of the past, our research team is really committed to growing and moving forward in partnership with Indigenous nations in the spirit of truth, reconciliation, and collaboration. And to do this, we are connecting with the most vulnerable youth to offer mental health and wellness supports that they need and deserve, no matter where they live. So that's really the aim of this project and the root inspiration for it. So I am a research manager with the Centre for Health Research, Innovation and Scholarship with Saskatchewan Polytechnic. Prior to coming to Sask Polytech, I practiced on the front lines as a paramedic for just over 10 years. And most of that time was spent serving rural and remote communities of northern Saskatchewan. Serving these communities, I witnessed the barriers to care that are faced by Indigenous youth firsthand, especially those living in those rural and remote communities, as oftentimes we'd have to travel with them long hours just to access resources that many of us that are attending today, or many of us that live in more urban centers, often take for granted. So that is one thing that kind of sparked an idea for the need of how can we use technology to connect, and we'll get more into that as we go. But an important statistic that I do want to share with you today is that although Indigenous Canadians represent only a fraction of the Canadian population, Indigenous youth are 5 to 6 times more likely to commit suicide than non-Indigenous youth across our country. So that's a pretty dismal statistic and pretty prevalent number there. And so these statistics paired with my firsthand experience on the front line as a paramedic is what motivated me to explore how can we connect people from where they are to where they need to be, and how can we offer these resources without people having to leave their communities. So our project's first partnership is rooted in this beautiful community. This is La Loche, Saskatchewan. It's about 6 and a bit hours north of Saskatoon. And I have been working with the students and staff at Dene High School, the high school in La Loche, for the past 3 years. We had a bit of a slow start because of COVID and just difficulties getting into the community. But over the past 2 years in particular, we've really made a lot of headway with this project. So we started with introducing the idea of virtual reality technology as a mental health support to these students, and saying, what could we do with this, and what would you like to see this technology used for, and how can it support you to live your best life, is kind of what we entered the school with. So we started working with the students in La Loche, and just recently, last fall, we've also started working with East Central First Nations Education Partnership, and they are the board of directors for the Bernard Constant Community School and James Smith Community. So I'll just give you a little bit more detail as we move forward on kind of the steps we've taken in this research, what our findings are with the data, and then also an idea of how we plan to move forward with our partnerships and how we plan to grow our partnerships. The work that we've accomplished with our partners to date has really led our team to envision an innovative approach to mental health care that's driven by the youth themselves. So we always try to prioritize the voice of the youth and what they want to support them, and how they believe that this project, the direction it should go. So for our next steps of the project, we're focusing on scalability, and we're working to grow additional community partnerships, and we're looking to establish and trial a transferable virtual wellness framework for Indigenous youth that can be adapted and utilized across multiple communities of varying cultures. So really looking on what would this look like with the different cultures that we're aiming to serve. So this project employs a community-oriented action research model. And what that means is we don't just go collect data, write a report, and that's that. With being an action-oriented project, we always want to learn and grow based on our experiences. So to start the project, it started with reflection. So reflecting on, as a paramedic, what did I witness as a care provider? Now, I had this amazing opportunity moving into a research chair, now research manager position, that allowed me to focus on research full time. And so rather than focusing on a clinical aspect or a practice in paramedicine, I really took a step back and I was like, what is a systematic challenge or barrier that I witnessed as I was working? And how can we really dig into the root cause of that and make some big change here? So taking a step back, just looking at how many calls we responded to that had to do with mental health, how often we had to take community members out of their communities just for an assessment or to receive the resources that were required. And oftentimes kind of the fallout from that, where there wasn't the appropriate follow-up or continuation of care. So reflecting on those experiences that I had witnessed, I did connect with La Loche And we went to their students and said, how do you feel about the mental health care? And what do you think would best suit your needs? And so the first two focus areas were really the outline and identify. So outlining the current status of mental health supports that are available within that community, and then identifying gaps in service through the perspectives of community members, but then also focusing on what's being done really well and how can we also continue to build on that and promote that. So we reflected on all these things and we came to the conclusion that the youth are feeling quite isolated at times. And so they're really looking for connection with youth from other communities, and to kind of break down those walls of isolation. Youth were looking for different ways to access different educational material that they maybe didn't have the courage to ask for. Youth were looking for different role models. A lot of the youth didn't quite understand what a mental health resource was or what that entailed. And many of them right off the bat were like, I don't need these resources or supports. So just kind of reflecting on what does living well or living your best life look like, and what can we do to support that or enhance that. And so by exploring these things and collecting some data, we were able to come up with a plan. And now our next steps are to act on that, observe the outcomes, and then continually reflect, plan, act. And so every single time that we host a summit, and we'll talk about some of these wellness summits that we're planning to host, or every time we introduce a new virtual reality resource, we don't just stop there. We don't just say, here you go, here's your resource, and that's that. We really want to observe the impacts of that and then reflect on what we can do better, what worked well and what not so well. Really analyze our lessons learned and then continue to grow and build this project as we move forward. So as I said, so far we've been focusing primarily on the outline and identify phases of this project. And now that we have a really clear vision of what the youth want to see and the direction they want to go, we're focusing on securing funding to be able to offer that. So we want to explore and develop this. So what would this actually look like? Let's explore the VR and how it can be used. Let's make a couple segments and try them, and then just really assess kind of the outputs of that and see if we're achieving what we're striving to achieve. So our first phase of data collection started with 6 focus groups. So we conducted 6 focus groups with our partnering community. Our focus groups included elders, clinicians, teaching staff, support staff. We've also held 2 focus groups with the students, one for just grade 9 students and then a second focus group for grade 10s to 12 students. And then focus groups were followed by in-depth, semi-structured interviews with key community informants. It was really important to me and to our team that we prioritize the voice of the youth. We didn't want to come create something that the youth had no interest in or didn't identify with. And so I do have to admit that our focus groups with the students were a little bit of a flop. And although the adults had a lot to say, our clinicians had a ton of insight to share, and we'll look at a few of their quotes and the findings there. The teachers had so much knowledge and insight to share. The youth were pretty quiet in the focus groups. So we actually circled back a few times, worked on building some stronger relationships and building some trust. And about 6 or 8 months later, I did spend another day in the school and just opened the door to interviews with the students. So opened it up that if you want to share your thoughts, feelings, experiences, whether you want it to be you or you and a friend, we will do these interviews. And it actually was really successful, and we were able to follow up with 13 additional interviews that express the voice of the students. And I think it really outlines and frames this project. So really trying to take those voices and frame the next steps of our project. So analysis of the data revealed themes surrounding the underlying causes of mental health issues, perceptions of current mental health services, barriers to accessing mental health services, opportunities to support the empowerment of youth, and then recommendations for an alternative approach to mental health care. As you can see here, this slide, and then as well as the next 2 slides, are going to share some quotes from our research participants as they shared their stories and experiences in the focus groups and interviews. We'll start with the voices of the youth. So Youth shared how trauma, stress, grieving, and suicidal thoughts often compound their inclination to seek relief from drugs and alcohol and kind of drove them down those pathways. One student shared, and you'll see it in the top left-hand side of your screen here, is I tried other things and I just tried so many things to numb the pain, but nothing seemed to work. And a lot of times these statements and what was being shared with the students really had this underlying sense of hopelessness and just, I didn't know what else to do, or this is what I witnessed every day. And so I don't know a different pathway. Some youth were really hesitant to admit that they themselves would benefit from resources labeled as mental health support. One student in particular that stood out to me, he shared how his brother had died the year before of suicide and how his brother could have benefited from maybe these resources. Maybe my brother could have used this, but he still hadn't recognized how he himself could have potentially benefited from these type of resources or wellness tools. Another interesting finding was that although many youth claimed not to know much about their culture, when asked what brought them joy or comfort or what just made them feel happy in general, we were exploring the positives. Many students referred to land-based practices, culture, and language. So again, like the quote in the middle of your screen here, my grandma, she's fluent in Dene, you know, so people tell me when you pray in Dene, it's powerful. This is what grandma tells me. So whenever I'm feeling sad, I try to talk to her and she just pray for me in Dene. And after that, I just feel okay, happier. Also, there's local legends. And for, if you ever ask the students, we're going to film some virtual reality and we're going to share about your community and culture. What do you want to record? So many times the same local legends or the same elder stories continue to come up, and just wanting to capture that and be able to share it with others or to be able to immerse yourself in that story at any time was really popular with the students. So these were some of the key findings with the students. The next thing we're going to look at here briefly is the voices of the teaching staff and what we found out from the teaching staff through our focus group. So being a teacher entails a lot more than just teaching the curriculum. And that was obvious throughout. In speaking with the teachers and their students, it was evident that teachers serve as trusted confidants for the students. The quotes you see here are some of the things that the teachers shared about the current state of mental health of the youth in La Loche, and really some of their raw insight to the lived experiences of their students and the reality that their students are living. So teachers spoke at length about the living conditions of their students, how that impacts their learning and their ability to excel academically. Some of the teachers spoke to the added responsibilities that many of the students carry for their families. Some really highlighted the fact that some students didn't want to graduate grade 12, or if they did graduate from grade 12, they didn't want to leave the community for post-secondary because they have a sense of abandoning their family or shirking their responsibility, and so refusing to leave to pursue further education. As one teacher said, and this one teacher was speaking to some of the living conditions and some of the experience of their students. So one teacher did talk about some of the living conditions. If you look at the right top hand corner of your screen here, I've heard stories from students where they don't have or have never had a bedroom, don't even have a mattress, you know, they have a blanket and a pillow, and that's the reality. Some teachers then went on to talk about when this is a normal part of society, how do you develop positive habits and patterns? And so, and the most impactful one here for me is right in the center here, is where the teachers talked about the community experiences such a high number of suicide that is just like you're complacent to it. And so just this being such a reality, such a norm, and how do we break some of these cycles and start moving forward as a community, as a province, or as a country, is really coming to light in this study. And this one may be of much more interest, or not much more, but of great interest to our group, our attendees today. So the voices of the clinicians. So we had a great focus group with the local clinicians. It was quite diverse. We had some nursing staff, we had some physicians, we had paramedics, social workers, and mental health care providers in this focus group. So local clinicians really shared how they felt that the current mental health crisis is interlaced with histories of trauma perpetuated by colonial legacies. Um, our participants indicated that growing up in a trauma-prone environment limits one's ability to move forward, provoking a state of inertia or our inability to break social barriers. So they really spoke about how this will limit one's ability to move forward, and also spoke to how traumatic experiences have long lasting and far reaching effects from generation to generation. And it's interesting hearing the clinicians talk about this in comparison to, say, teachers or community members or parents, because the teachers were really kind of bringing in the underlying physiological aspects and what compounds the outcomes. So clinicians expressed a sense of dilemma when and sometimes criticized the design and approach of mental health care as being untailored and not able to meet the needs of the unique population group. One clinician expressed her frustration with this, and you can see it in the bottom left-hand corner of your screen. It says, "I'm quite frustrated. I feel like I'm perpetuating a system designed to fail and has failed for 20, 30, 40 years, and yet we're still perpetuating it. And I'd like to know why we are doing something that doesn't work." So, and I remember this, I can picture it in my head clearly, the emotion tied to this and kind of the frustration and underlying, you could see it as she spoke. And so it, and I could see the frustration coming from the clinicians that we're here to help, but we feel like we're making no impact and we don't know what to do next. And the system or the approach we're taking just isn't working. Another quote that really stuck out to me is in your top right-hand corner, and it's, "There's this vicious cycle of hopelessness, and the idea that I have a future, I have a better tomorrow is not part of the language." So really, again, talking about that underlying sense of hopelessness that's being expressed by youth and really not seeing tomorrow or being excited for tomorrow, which, you know, looking at youth and looking at young kids and just seeing that excitement in their eyes, it really drives them forward and drives youth to excel. And so when you have this sense of hopelessness and no future, it is a huge barrier and challenge to overcome that. So these were some of the main quotes from the clinicians. Um, and I will pause here because it does seem dismal, and a lot of these quotes kind of have a negative undertone. And that's not, it's not trying to reflect this community in particular in a negative way, because I am certain that when we share our findings report with other rural and remote communities, whichever ones they are, and the ones that I used to serve as a paramedic, these community members will read this report and they will relate to our findings. And quite frankly, it's not because these communities are doing anything wrong. These findings and these experiences are because of colonialism. They're because of ongoing trauma, and they're really because of the way society has evolved and transformed over the years. So through the partnerships I've created so far, even though these are the findings and experiences being shared, I must say that this project has led me to meet some of the most resilient people I've ever come across in my life. I've met the kindest, most selfless souls, and it's really the community members that I'm interacting with that have ignited this passion to act and to truly believe that there could be a better future and a better way to address the mental health care of youth. So, and that's really what keeps driving this project forward. One of my partners explains what we're doing as breaking trail, and I like this because he says it's not going to be easy, it's going to be hard, and we're going to face barriers, but that's why we're doing what we're doing, and someone has to break trail. And so I'm excited to work with him to do this and to continuously build on our successes and learn from our challenges and to continue moving forward and continue breaking trail. One of the other participants, actually one of the clinicians in the focus group here, they described the circumstances as, she was talking about how this has occurred over years, and she was talking about intergenerational trauma and the impacts of that. And she referred to us, she said, it's like we're all paddling in a huge canoe together, and we're just paddling together and we've been going in the same direction for so many years, for decades. And now we need to change that direction. And you can't do it super quick, because if you all try to turn really fast, you're going to tip your canoe and it's going to cause more harm than good. So she said it's going to take time, it's going to take patience, it's going to take teamwork, and it's going to take communication. And so I think too, sometimes it just seems like too overwhelming, or something that we're not going to be able to overcome or change. But I think if we all take time to do our part, work as a team, communicate, and make those small changes and adjustments, that in the long term it will have great impact on our youth, and so on our next generation, and create a lot of change and growth. Let's go to the next slide here. So all of our themes really resulted, and they were really in a need to establish a sense of safety, identity, and belonging for youth. So all of our findings really, if we looked at it, we looked at the broader themes. Every intervention or every event or activity we're going to try to do, any kind of interaction we're going to try to do, we're really focusing on, we need to create a safe environment. We need to teach aspects of safety. We need to build identity for youth and support the youth in finding and uncovering their own identity. And then again, with that sense of isolation, really focusing on fostering and supporting that sense of belonging along the way. So findings surrounding opportunities to empower youth really focused on breaking the cycle of intergenerational trauma, building hope, and taking responsibility. Recommendations that came from our data collection surrounding an alternative approach to mental health care really focused on excitement around this innovative approach and using some technology, but it also changed a bit of our first hypothesis and our first of our initial assumptions of where this project was going to go, because it's more than technology, and it's really led to a multi-pronged project, or project that combines face-to-face interactions with technology. And that was really important to the youth and to the care providers and the community members alike. So participants exceedingly expressed excitement surrounding the possibilities of leveraging virtual reality technology to support well-being, but they also elaborated on the need for an in-person component. They really need that connection, and we all need that connection to thrive in life. And so it makes perfect sense that that did come forward in many of our findings. So the students, when they were looking for what they wanted, as I said, there was a big in-person component. And then we're kind of getting to this, we're analyzing our findings, thinking about next steps. What are we going to focus on with the virtual reality? Because now we have this huge picture of what the students want. And we were approached by the East Central First Nations Education Partnership, as I mentioned. So after the events that occurred in James Smith in September of last year, the director of the Educational Partnership came to us and said, we've heard about this project. Is there anything that we can do to work with you to support our youth? And we don't have a virtual reality platform. We really didn't think that was appropriate at the time. So we said, let's host a mental health, a wellness day for the students, followed by a wellness summit. The youth in La Loche, they're really striving for connection, and maybe this kind of connection and introduction to wellness resources will be a benefit. So we went into the school at James Smith for a mental health day. And what we did that day is we introduced 10 different wellness practices. And so they were from yoga to drum making to TP teachings. We had a psych nurse come in and introduce play therapy, a healing circle with an elder. So there was a great combination. There's a flip the script on how to change your perspective from negative to more positive outlook on life. There was an anti-bullying session. And so we introduced all these different topic areas, and they were all underlying in wellness and wellness promotion. And then we invited all the students to come join us on, I called it a 2-day vacation, and it really was. but a 2-day wellness summit. And we said, we're all leaving. We're going to go to Elkridge for 2 days, and we're going to go on vacation together, and we're going to immerse ourselves in wellness practices. But I think the key to this retreat was based on the 10 areas that we introduced during the mental health day. The students, when they registered to come to the summit, they picked their top 4 out of the 10. So at the summit, all 10 were offered, but we adapted, or we really made everyone's experience, we individualized everyone's experience. So we didn't say everyone has to learn yoga. Yoga is good for you. You should all learn it. It was, if you're interested in learning more about yoga, sign up for it, and we'll do an introduction with you, and you can go home with your yoga mat and try to practice this wellness practice mindfulness. So the students came, and out of the 10 activities that were provided, they each got to participate in a 1.5-hour workshop in 4 of them. And so we had all these different workshops going, and then in the evening we had some large activities like paint night, and we had the Cree Land dancers come and just try to really immerse ourselves in culture. And outside we had many outdoor activities occurring, and it was really well received from the students. And when we did the survey after, just to get some feedback, we had some pretty intense feedback. One of the students actually said about the yoga, she said, "I've never felt so embraced by love in my life." We had some major breakthroughs with some of the students in the play therapy as they expressed through clay art and just conversation, where what the safety situation was within their home or at school, and how they felt, and then just started developing safety plans with these students, and follow up so that they could be safe moving down the road. So it was, I would say, really successful. Overall, the students were engaged, and the event offered many wonderful wellness learning opportunities. And they're continuing on with annual wellness days or summits, and it really sparked or ignited our realization that we need to do this as a provincial summit with youth from other communities. We need youth from multiple communities to start connecting, and then we need to continue these connections through virtual reality. So as mentioned, our findings have led us to envision a multi-pronged initiative that interweaves Indigenous designed results-based in-person wellness retreats to provide the youth with the opportunity to really establish and solidify these relationships with one another, with care providers, and then an opportunity to be introduced to non-pharmacological wellness techniques and grow capacity needed to nurture their own well-being long-term. And then this needs to be followed by fostering these relationships and continued access to the wellness resources by using virtual reality technology. And for those of you who have never been exposed or have never trialed virtual reality, what virtual reality is it's a headset, and you put it on and you're completely immersed in the environment that's within that headset. So when I first came to the community with the idea for this project, I had my paramedic lens, and I'd really envisioned offering counseling through the headsets. Don't have these specialists in every town. It's not as accessible. This is a way to enhance accessibility. But now working with the students, this opportunity to leverage technology has just skyrocketed, and their creativity surrounding this is incredible. So rather than just offering counseling or meditation practices through a headset, all these points you see on the screen here come from the youth of what they'd like to see the headset used for. So now we're really dedicated to developing a secure, dedicated platform for students to access all these resources. One of the top priorities for the students was an interactive social platform. So we all know you go into chat rooms on social media. VR already has social platforms available, but we want to be able to offer a safe, secure social platform for youth. One where if they went to a wellness summit or they just want to connect with others that they can relate to, that it's a moderated, safe space that they can go on their headset and connect with other youth from other communities across the province, and we're hoping eventually nationally. One of the stories that really bothered me in speaking with the youth from one of our partnering communities is the student in particular really had difficulty socializing or talking to others and didn't know how. So she did have a headset though, so she decided she was going to teach herself how to interact with others and get comfortable talking to others by going on social platforms on her VR headset. And they're not moderated and they're just public platforms. And the interactions that she described to me, it was clear that this youth was being groomed for trafficking. And I couldn't stress enough, I was like, please do not travel to the city to meet this individual. But again, with that lack of identity and that lack of a sense of belonging, when someone expresses they care and they will groom youth and bring them in, and it's really tragic. So imagine being able to go to a social platform where you know it's safe, where you know the people you're talking to are truly who they say they are, and are people that you can relate to and foster relationships with. And that's really our goal here is the safety is always underlying everything we do. Another key component of being able to offer a dedicated VR platform is to be able to offer educational content. So there's a lot of questions, especially in small communities, especially where everyone knows everyone. You have a question, but you just don't know how to ask. I know it's easy to Google everything, but a place where you can go look for answers that you're a little uncertain to ask, that you don't want to share with other people, and you want to make sure that the information you're getting is valid. So really being able to have educational content for the youth to access, a library of educational content for anything they're curious about, want to learn more about, things like that. The other piece here is role model sharing. So, and again, that's that sense of belonging or connectedness. So having role models share their experiences and share a sense of hope and how they triumphed or overcame that, or just sharing that you're not alone and you're not the only one in the world experiencing this, and having someone to relate to is really important. So we hosted a showcase last week, and we had a beautiful speaker, Beatrice Wallace Wolf, and she shares her experiences and hardships of growing up and what she had to do to overcome that. And this lady is just brilliant. She's an author, so if you ever have the opportunity, her book is called Wolf Woman, I believe, and it's incredible to hear what she's gone through and to where she's gotten. And she loves speaking at these events, but she shares her story because she wants to make a difference and she wants to make an impact. And so she actually came to our last youth summit and she shared her story a bit with the youth, and then ran a writing workshop and taught them how to journal and how to process some of their feelings and work through it through journaling. And her session was full every time, and the connection she had with the students was just incredible. So the role model and the sharing is really important here, and having that person to look up to and to relate to. Another thing that we're looking to offer is synchronous workshops. So it's nice to have the in-person summit, but all that travel is pricey, and that's taking us back to that first barrier we're trying to overcome and in the first place. We want to be able to offer resources without having to leave the community. So really have ongoing workshops through the VR headsets that if you're interested in a certain topic or you want to participate, you can log on through your headset and be there live time and participate fully. So offering different synchronous workshops. And then this one's my favorite one, and this one came directly from the youth. So we've made three VR segments so far. Two we've made in the community. And really talking to the youth about when we were doing the interviews, and it was like, what makes you happy or what makes you feel safe or brings you happiness? And a lot of the times it would go back to, my favorite place in the world is here on the lake and listening to the water, or I will sneak out of my house at night and just watch the northern lights. That one came up quite a few times. But anyone who's lived up north, or even anyone who's lived down south this April, will know that that's not always possible when it's a big snowstorm or it's the middle of winter in December, and it has been for months already. You can't just go sit by the lake and listen to the water. And so what we've done with the students is we've captured their favorite places in the high season. So when you can go do it. One we want to capture this summer is actually just kayaking on the water and listening to the paddles through the water and just capturing that. So we're not trying to replace doing that in person, and we're not trying to replace teachings in person, but you can't always access that in person. So if you're having a really long winter and you're having a real bad day or you went through loss, imagine being able just to go to a quiet room, put on the headset and fully immerse yourself in that environment that brings you comfort and a sense of safety at any time. So it can be January and you just feel like you can't move forward today and you just need a 5-minute timeout from life, and that's okay. And you can go to a quiet room in the school and put the headset on and access that location and just be immersed in it and absorb it for 5 minutes to kind of reset and be able to move forward. So I think that's a really good, like, I think that's great and it's brilliant. And so that's what we are capturing with the students now. And the students took that one step further. They're like, I want to share my favorite place with youth from other communities. I want them to see the beauty of this and what we have to offer. One of our first segments in Laloche it's myself and we have a student advisory. So it's the 6 students in the advisory, and we actually went out and had a fire one night. And we're all sitting around the fire, and then it fades out to the lake, and it's Elder telling the story of the lake monster in Dene with subtitles. And then it comes back to the fire. And that was our first segment. And the students completely decided that that's how it was going to go. They're part of it. It's so fun watching them when they put the headsets on and they recognize themselves in the VR. And so it's really interesting, and it's a really neat little segment, just kind of increase comfort and capability with the technology and introduce VR and kind of what we're able to do with it. And then last but not least, the counseling and support groups have come up. Counseling, a lot of students are happy with face-to-face counseling if they can access it. Some students, so there's kind of that catch-22. You want to trust your counselor, but if they're from the community, it's a little too close to home. And what if it's your auntie, or what if they're best friends with your parents? And there's maybe some trust issues there. So what we're really looking to do is have dedicated clinicians that are on site during our summits that can start creating connections in person and start offering some care, but then to continue that care through virtual reality so that you still do have that trust and that connection, but we don't have to travel to 10 different communities to offer care following the summit. But we're also really trying to be trauma informed. So never wanting to offer something and then have to take it away or for people to have to re-explain themselves numerous times. So really focusing on continual care, continuation of care, and how we're going to be able to achieve that and sustain that along the way. And then it was taken to another level up where it's like support groups. I would never step foot in an AA meeting in my hometown because everyone will know me and they'll know. But maybe I could have a little avatar that will attend one through the VR, and I can get that support that I really, really need. So just some of the great options or services we could provide through such a platform. So I know I've been babbling on for a while here, so just a few more slides. I'm just going to kind of summarize the next steps of our project and where we're focusing and the direction that we're headed. So our project's really embedded in what's known as a civically engaged triple helix model, and this really prioritizes sustainable innovation in the best interest of long-term societal benefits. You're all here today because you know that there's a need to establish and draw on multidisciplinary networks. We need to stimulate technology and innovation paired with social relevance. So the concept of this triple helix model really leverages expertise, resources, and regulatory capacity by joining forces of government. And this would be like it bans municipal, provincial, federal, bringing together industries, so health and education sectors, bringing together the researchers, and really bringing everyone together to varying degrees while simultaneously prioritizing social responsibility. And to do that, that's by ensuring knowledge users, so in this case it's the youth in particular, bigger picture community members, to ensure that the knowledge users drive all the overarching conditions and mechanisms of everything that we do. So constructing these interdisciplinary teams is advantageous as it brings together different opinions, perspectives, and it really leads to greater creative synergy and innovations. And that is obvious with how this project's evolved just with the youth of the the voice of the youth and community members with that first round of data collection. So there are a lot of ways to get involved in this project. We're continually building relationships. As I had mentioned earlier, we are planning our first provincial summit this fall, and we're really looking to bring together youth from across 10 communities, about 6 youth per community, to bring them together for a 2-day summit. We are going to frame it similar to the one that we did last fall with the James Smith students, just tweak it a bit based on the feedback, always trying to learn and grow. But we really want to bring youth together from multiple communities, start making those connections, start introducing those wellness techniques. And then while we're there, even though we don't have a dedicated platform for virtual reality yet, we will be capturing virtual segments while we're there, and everybody will be able to take those home on virtual reality headsets. So not every student will get their own headset, but each participating school will get some headsets to come. And some communities will get to take some headsets home with them, and so that they can keep accessing this information. Sorry, I out of the corner of my eye, I caught the chat moving and it distracted me, but I will just leave it and we'll do all the questions as soon as we're done here. But so the point of incorporating technology, even though we don't have a fully dedicated platform yet, is we really want people to get comfortable using it. We want people to recognize it as a resource. You'll see this picture here. This was one of the yoga sessions, and just based on that comment from that one student, that had never been so embraced by love before, or felt so embraced by love before. Imagine if you went to a yoga session. The instructor here, you can see her on the front there. Her name's Dawn DeGuire, and she's part of the Saskatchewan Indigenous Yoga Association, and she has committed to continue working with us. And she runs this yoga session. You get your mat, and you get to take your mat home and continue practicing yoga, and we're promoting that. But then you get back home and you're feeling kind of alone. You have no one to do yoga with, and you miss Dawn, because everyone would miss Dawn after they meet her. So you can take your headset home, and we'll have a segment on that headset where it's actually Dawn doing kind of a mindful moment to talk you through a few things. So you can still feel immersed in an environment with her. You can still have a connection with her, even after the summit's done and concluded. The next priority that we're working on establishing is a rural and remote, a community-based mobile research lab and learning center. So right now, when I go out to communities, I have like my little tote in my car, and we try our best and we try to engage students, but students are busy and sometimes it's hard to get that engagement right off the ground. So we're really looking at establishing a mobile research lab, where we can take our lab to the communities, because there's no point having a lab in Saskatoon and everyone having to come to us. We really want to take this technology out there. We want to have a lab where we can have kind of theater style seating. So there's a screen that we can do a short presentation. Every student would have a headset available to them to immerse themselves in the segment and learn how to access the materials. Half of the lab station would be actually a community kind of workstation that would allow up to 8 people to work together, and we'll have state-of-the-art 360 cameras and virtual reality development equipment, so we can actually go out with the cameras, capture content, load it on the headset, and people from the community can come do that with us and see us load on the headset and then experience what they just created right on the spot. So just having that ability to offer that on the spot. And finally, and very, very importantly, is we're really focusing on the development of the VR wellness platform. And so, as mentioned, we really want to have a dedicated platform to be able to offer all the resources that were listed earlier, and so that youth can access this in their home communities as they see fit and really access what they need when they need it without having to leave their community. So on the development side of things, we have partnered with Luxonic Technologies to develop and trial the wellness platform. And they have been from day one, and they continue to be directly involved throughout each step, assisting with gathering, analyzing, and prioritizing the knowledge required to build this platform. And they have the expertise to ensure that it's secure when we try to offer the resources that we're planning to offer. So that is really it. In sum, our project aims to support youth, the next generation of leaders, and we're planning to do so by weaving in-person wellness supports with VR technology so youth can access the supports they need when they need them, without having to leave their community. And I would invite anyone that is interested in learning more to reach out to me. I'm always happy to talk. And so thank you very much for your time.
Thank you so much, Lindsay. What a great way to kick off a Friday. That just so inspirational. I know this is such a complex area that you're working in, and just a beautiful example of community-led partnerships and hearing from the voice of youth to help inform your way forward. So thank you so much for sharing with us this morning. We did have a few questions come in throughout your presentation that maybe we'll start with as we welcome folks to put their questions in the chat. Earlier in your presentation, when you were giving us a rundown of the focus groups that you did and the different perspectives, on the voice of the clinician side, one of the comments was recognizing that a different approach is needed. Just curious if from that group you also solicited ideas of what that different approach could look like, and if so, what kind of things came up in that conversation?
So yeah, a key thing that came out in that conversation was one of them mentioned in some communities there's not enough counselors, but the one we've partnered with in particular, they do have counseling services available. And she's saying, she's like, we have these counseling appointments that aren't even being filled yet. When we try to keep offering resources, we add on more counselors. And so we're just kind of keeping the same thing we've always tried without trying different ways when it's not being filled in the first place. So some of the things that they talked about was they really appreciated that we're listening to the students. They do appreciate a more holistic view of well-being and not just hyper focusing on counseling. But we did not dig into what that would look like from a clinician view. There was that expression of frustration that they're perpetuating it. And then they followed with enthusiasm about trial the virtual reality and the possibilities of this and incorporating culture, but it didn't go well beyond that. So again, thanks for highlighting that. That's a good thing to explore further. But yeah, that's kind of where it stopped within that focus group in particular. We're really looking to partner with clinicians every step of the way. First of all, because we don't want the youth in the community come up with a solution, then we take it to the clinicians and clinicians be like, that's not possible. And we're like, well, good luck, because we all have had that dumped on us before. But really working from the beginning, saying, here's some ideas, let's brainstorm together and see what solutions we can come up with together.
I love it. Yes, and there'll always be that tension, right, of great ideas and needing to actually operationalize and move forward on those.
One of our primary goals is to reduce, we do recognize there's a bit of a bottleneck in services. So how can we reduce that and alleviate some of those pressures from the health system as well as we move forward?
Great, thank you. Um, Another question that had come in earlier from Tammy. I love that you involved the youth in looking for ideas of what students could use VR for, and noticing a lot of consistency in the suggestions that they rose. And you spoke a little bit about forming this content with the youth. I'm wondering if you can tell us a little bit about what that soliciting their feedback and advice looks like. I know that you mentioned the youth advisory committee at the school. Is that kind of the primary feedback mechanism that you're using to hear that voice?
Yeah, so initially we wanted to get their voice. So we did that through our data collection phase. And so a big driver of this research is taking all those considerations or suggestions that came out in those interviews. But then we do have an advisory committee. We're very inclusive with it. So some of the members come and go as they see fit, but I do see about 5 or 6 students are at every meeting or every time we're there. So every time I'm in town, I always bring in lunch. I have open door technologies out, and then we just kind of discuss what's happened so far, where we plan on going, and any other great ideas that they might have, and try to leave it to open discussion. Our plan for the summits or the wellness retreats as well include data collection throughout them and gathering the voice of the youth there. So some exploration beforehand, kind of seeing where our starting point is, and then getting that feedback following it to further guide next actions.
Perfect. Thanks so much. A comment, and then a question from Tracy here. Very innovative idea, but wondering if this is an example of putting the cart before the horse. If relating back to some of the comments that came through in the comments section where you gave us some quotes from some of the participants,
Mhm.
recognizing that if some folks don't have bedrooms or mattresses, why are we not putting our resources there first, ensuring basic determinants of health are met so that these resources augment health versus putting paint on a rotten board? The
That's a
tough
good
one.
comment and a very good point. No, and I get it. And that's why I said sometimes this project seems like really overwhelming, and it's like, will I actually will our team make an impact, and is this a good idea or not? But every time we circle back, a lot of it is related to that intergenerational trauma and these cycles, and we're trying to break them. So I think that's really why we're focusing on the youth now. So what do we need to really support the well-being of youth? One of our partners that we're working with a corporation trying to establish a partnership right now. And it's really interesting working with them. So they're trying to build capacity to serve their employment. They're trying to build employment, and they'll come in and do training for their corporation in particular. And now they're looking at partnering with us because they're like, if you're not healthy and you're not in a good mental state, you're not going to be able to hold a job. You're not going to be able to go through training. And you're not going to be able to kind of break this cycle that's occurring. And so I think it's not going to be an overnight change. And yeah, we definitely have to address the determinants of health and how can we have more stable living conditions. And there's already a lunch program at the school, and that's great and that's really helpful because nutrition is so important in living well. But I think we also have to concentrate on when we're living in those conditions and we feel like there's no escape, what are some of the things that can support us and help us turn that around? And this is what we're hearing from the youth is we want to turn it around by hearing from others that have been through it and see how they got out of it. We want to connect with other youth that relate to what we're experiencing and don't judge us about it. And it will be baby steps and it won't be overnight, but I think it will have a great impact for a lot of the next generation. And then hopefully this isn't happening down the road and we're slowly edging some of that change in.
Absolutely. And this is such a complex um, issue to address. And I think it's one of those areas where we need to overwhelm an overwhelming problem. So there's no one thing that we're going to do that's going to change the trajectory of outcomes. But this is a beautiful example of multiple ways that you've contributed to addressing this very complex problem.
And we keep looking at everything as an ecosystem and how everything really impacts everything. So what impact can we have and who can we partner with so we can be our impact can kind of synergize with what their aims and objectives are to help build and grow that in a positive way.
Yeah, sounds beautiful. Almost like social movement theory, right? How do we band together towards a common aim?
And then
And maybe,
sometimes I'm like, oh my goodness, what have I gotten into?
yeah.
So please
Um,
know I don't underestimate like how big this is and feel that this is just a quick solution. There it is a long term and a very big picture.
I can't wait to see where your work takes you, and we'll be interested to follow the trajectory of that for sure. So I think we'll end there for today. So Lindsay has provided her contact information. I know that there's still some comments and questions coming through the chat. So she'll welcome you to reach out to her if you'd like to further connect or have any questions that you'd like to follow up on. But as we close out for today, as always, we are always excited to hear of new speakers. So if you have an idea, a project, some lessons learned that you would like to share with our community of learners, we always are excited for folks to reach out. So we'll drop a link in the chat there of where you can sign up to become our next QI Power Hour speaker. In the interest of continuous improvement, we ourselves are always looking to improve this offering. So we invite your feedback on the session today. You'll notice that you'll get a little prompt as you exit the session today. Just a note that this is a trusted site, so we invite you to click continue and share your feedback on the session today. And in terms of the next time we come together, our May session will be focusing on some further local innovative work that's happening within the province. So we'll be joined by Jill Forrester, who is the Director of Continuous Improvement with 3S Health. talking about some of the work that they've been doing over the past few years around defining and measuring impacts on patients' lives. So we'll look forward to having you join us again for that session. And until then, take care and we'll see you again soon. Bye, everyone.